Hi everyone, it's Debbie here, and today I'm going to cover blood, and in particular, I'm going to look at red blood cells, blood type or blood group, and its compatibility. So what is blood? What is our blood made up? Our blood is made up with red blood cells, white blood cells, platelet, and plasma. Now, looking at red blood cells in particular, it has like the shape of a donut, and this or a biconvex shape, which allows them basically to squeeze through tiny little capillaries, and this also helps to provide high surface area to volume ratio, allowing gas basically to diffuse effectively in and out. The red blood cell is responsible for carrying out oxygen to the cells, and also returning carbon dioxide to the lungs for it to be exhaled. Now, looking at the normal hemoglobin level in an adult, it should be between 125 to 160 thereabout. Now, looking at the four main blood group type, which is A, B, AB, and O. So it's quite important to know that O, which is the universal donor, and basically can give blood to everyone, and also can also receive blood from everyone. And AB, which is the universal recipient. Blood type A can give blood to A and AB, but can receive from A and O, while B can receive blood from either B or AB, but can receive from B or O. So actually, to make it a lot easier, just remember this, that O is a universal donor, and A is a donor and also a recipient, and also AB is a universal recipient, while B is donor and also a recipient. So it actually makes it a lot easier. I think one way that I actually understand it is you're not adding anything. That is just one way it helps me basically to remember this stuff, that actually you're not adding anything. So let's say a patient is having a blood transfusion. What are the certain signs for like reactions or like allergic reactions basically you would look out for? It's basically high respiratory rate, rash, itchy, spike in temperature, and you don't want to give your patient blood transfusion while they're having spike in temperature, if it makes sense. Thank you all so much for basically joining and also watching this little video I did. I kind of feel that this making this video basically has helped me in terms of teaching and like basically micro teaching. I kind of feel that it has helped me. So all feedback are welcome. Please comment or please leave a feedback in the comment section on basically areas I should improve, because this is my second video on YouTube. So leave a feedback on areas that I should improve or areas that I should have done well, or maybe topic that you feel that I probably need to cover more, or things that you feel you basically need me to talk about, or like if you've got any questions to answer. I'm not really a professor yet, but I will try as much as possible to answer those questions you've got, okay? And this video was done like in clinical skills lab. We did like a simulation, and basically the skills that we did in the clinical skills lab was part of blood transfusion, and basically IV access, things to look out for whilst using IV access. And then we covered there were some scenarios, and then we looked at like blood compatibility, which is what basically I kind of covered in this section. But I know it's quite like a small video, but I will definitely leave a description. Like I will definitely leave more notes in the description below, so just have a look and like have a read, and just let me know what you think. All feedback, trust me, are welcome, and I don't really mind, because also it's also as a way that I could basically improve. don't forget to like and subscribe to my YouTube channel. Okay, show your girl some love. Bye. So take care for now, until again.